Hello and welcome to my teaching video on ECG interpretation. In this 10-minute video, we're going to cover what to check on the ECG prior to interpreting, how to calculate rate and rhythm. We're going to analyse the standard waveform, and we'll then apply these concepts to understand cardiac arrhythmias, and finally, end with some questions to assess what you've learned. Before we begin, let's start with a preliminary quiz. Have a go at labelling the different components of the electrical system of the heart. In order of conductance, we have the sinoatrial node, the atrioventricular node, the bundle of His composed of the left and right bundle branches, and the Purkinje fibers. If you are unsure about this question, have a go at reviewing some cardiac physiology before proceeding with the video. Here is our 12-lead ECG. Before we begin interpreting the ECG, we need to check a few things. We need to ensure the ECG is the right way around. As you can see here, this one is upside down. To check whether the ECG is the right way up, locate lead 1 in the top left corner as shown here. The patient's ECG should be labelled with at least 3 identifiers, including name, ID, and date of birth. To check the calibration of the ECG, we need to have an understanding of the two axes. The x-axis represents time and the y-axis represents voltage. The ECG paper is composed of small and large squares. The width or x-axis of a small square is equal to 0.04 seconds and the height or y-axis is equal to 0.1 millivolts. The width or x-axis of a large square is equal to 0.2 seconds and the height or y-axis is equal to 0.5 millivolts. Back to our original ECG, the calibration square is showing a width of 1 large horizontal square or 0.2 seconds and a height of 2 large vertical squares or 1.0 millivolts. This is a standard calibration of 10 millimeters per millivolt. The sweep speed should be set to 25 millimeters per second. To interpret this ECG, we'll be using lead 2. There are several methods that can be used to calculate the rate. The method used may change depending on the clinical circumstance, but it is more important to have a good understanding of whichever method you do use. Using our knowledge of time as representing the x-axis, we can calculate the rate. The length of the ECG trace is 10 seconds. We know this because 1 large square equals 0.2 seconds, and within the trace there are 50 large squares. 50 times 0.2 seconds equals 10 seconds. Next, we count how many R waves or peaks there are within the 10-second trace. So there are 12 R waves within the 10-second period. To calculate how many R waves there are in 60 seconds or 1 minute, we multiply 12 by 6 to give an answer of 72 beats per minute, which is our heart rate. To calculate the rhythm, place a blank piece of paper above the ECG strip and mark the position of a few consecutive R waves. Move the paper along the ECG strip and check whether the markings line up with the R waves. The R waves of this ECG are equally spaced, therefore the rhythm is regular. To demonstrate an irregular rhythm, here we have a different ECG. As you can see from the markings, the R waves are not evenly spaced, therefore this is an irregular rhythm. First, we'll look at the P wave. The P waves have been circled here, and as you can see, they precede each of the sharp peaks on the ECG trace. The P wave represents depolarization of the atria, which is initiated by the sinoatrial node. The SA node is composed of special pacemaker cells, which have the ability to generate electrical activity. The P wave should be upright and rounded, as shown here. Now we'll have a closer look at the sharp peaks of the ECG, which are known as the QRS complex. This represents ventricular depolarization and concurrent contraction of the ventricles. QRS complexes precede P waves and should be narrow, with a width of less than 0.12 seconds or 3 small squares. As you can see, the waveform for the QRS complex is much larger than the P wave. This is because the mass of the left and right ventricles is far larger than the atria of the heart. Therefore, a larger depolarization event is required for contraction. Finally, we have the T wave. The T wave precedes the QRS complex and represents ventricular repolarization, where the ventricles are relaxed. The waveform is rounded and upright. Note that atrial repolarization also occurs, however this is masked on the ECG trace by the concurrent QRS complex. Let's have a look at what we've interpreted and bring everything together. The rate is 72 beats per minute, which is normal as it is within the range of 60 to 100 beats per minute. The rhythm is normal as R waves are evenly spaced. The P wave is present. The QRS complex is present and narrow, and the T wave is present. Therefore, this ECG represents normal sinus rhythm. Now that we have understood the components of a normal ECG, we can apply these concepts to identify arrhythmias, which are a type of cardiac pathology affecting the electrical activity of the heart. An arrhythmia is when the heart deviates from normal sinus rhythm and beats either irregular, too fast, or too slow. There are many types of arrhythmias, so we will explore only a few. As we have learned, a normal heart rate is between 60 to 100 beats per minute. Sinus bradycardia is where the heartbeat is too slow, at less than 60 beats per minute. As you can see, the space between QRS complexes is much larger than normal. In sinus tachycardia, the heartbeat is too fast, at more than 100 beats per minute. The space between QRS complexes is much smaller than normal. Atrial fibrillation is the most common serious arrhythmia and is caused by rapid and irregular beating of the atrial chambers. The rate is above 100 beats per minute and therefore tachycardic. The rhythm is irregularly irregular, indicated by the irregularly spaced R waves. P waves are absent, and instead we see many fibrillatory waves. The QRS complex is fairly normal but with irregular intervals. Ventricular tachycardia, or VT, occurs when cells outside the SA node begin generating electrical impulses, resulting in improper electrical activity within the ventricles. The rate is tachycardic between 100 to 200 beats per minute. The rhythm is slightly irregular, P waves are absent, and the QRS complex is wide and bizarre. As you can see, the ECG trace for VT has a fairly distinct morphology. If VT persists, this can result in decreased cardiac output as the ventricles are not able to relax for a sufficient time to allow blood to enter. VT is also a concern as it can progress into the more serious arrhythmia of ventricular fibrillation. Ventricular fibrillation, or VF, is the most serious arrhythmia. There is no coordinated depolarization of the ventricles and therefore no ventricular contraction. The ECG trace shows no discernible P waves or QRS complexes. Instead, the morphology is chaotic with random inflections and deflections. If VF is not treated via defibrillation, this will result in cardiac arrest. Now we're going to apply the theory we've learned and practice some questions. Select the components of an ECG that indicate normal sinus rhythm. A. Rate between 60 to 100 beats per minute. B. Presence of P waves. C. QRS wide and bizarre. D. Rate between 80 to 110 beats per minute. And E. Regular rhythm. Pause the video now and have a go at this question. Here are the answers. So there are three correct components: a rate between 60 to 100 beats per minute, presence of P waves, and a regular rhythm. Next question is to label the components of the ECG waveform. So pause this now and have a go. And the answers are P, Q, R, S, T. Here we have an example ECG. Out of the three options, identify which arrhythmia this is and justify your answer. The answer is B, ventricular fibrillation, where the rate and rhythm is chaotic and there are no discernible P waves or QRS complexes. The final question is a bit of a tricky one because we haven't covered this, but have a go anyway. What is occurring in this ECG? The answer is there is no electrical activity. This is referred to as asystole. As there is no electrical activity, the heart is no longer functioning, resulting in cardiac arrest. Thank you for watching.